I'm very excited to show some of a more optimistic view maybe than what we saw so far. I mean, yes, blood is a complex biofluid, and we have to do a lot of rigor, reproducibility, transparency, reporting. We heard those terms a lot, and I'm going to show that the community is making efforts to kind of follow those recommendations. So I'm going to have two parts in the presentation. The first one is, again, discussing a bit the confounding variables for EV research, discussing the strategies to minimize the impact of confounding variables and how to report the quality of blood samples in EV studies, in particular with the publication. And discuss a bit what could be the next steps to improve our research with blood EVs. And I will describe also my experience in trying to develop a biobank that follow the most recent guidelines and how we can leverage from those samples for future study. So the first part of my talk is thanks to the work of 5 people of the Blood Task Force that we worked on developing surveys that have been sent to some members of the task force as well as members of the ISEV community to answer those different questions and get basically a feeling about what the community thinks about the complexity of the blood and the different strategies that we need to employ to minimize the impact of confounding variables. So the survey number 1 was 16 experienced blood EV researchers, so from the task force, blood EV task force, mainly from academic institution, and some of them were also from both academic and medical institution. And the survey number 2, we're excited to see that 176 people responded to the survey. Also 67% from academic institution, some of them both academic and medical institution, and 10% from private sectors. In terms of what cargo of interest, has been reported, so mostly proteins and RNA. We all know that covered most of the studies, but also we have metabolites, lipids, and DNA that are as well studied by the different investigators. So what are the confounding variables for EV research? And I think we got a pretty nice overview this morning with a great talk. And I highlighted the one that are based on the level of concern that are extreme and moderate level of concern. What we can see is that all those components are well reported by the community as well as the task force. So we have the lipoproteins, the non-vesicular proteins, non-vesicular extracellular RNA, and platelets, platelet-derived EVs, and erythrocyte are considered as main confounding variables. When we see the task force versus the international, the ISEV community, we see that we have, we identify pretty like the same confounding variables, but at different extents. Some of them find that, platelets could be less concerning for example, the wide community of the ISEV compared to the member of the task force who really think that platelets is a major contaminant. Now the question is, how do you measure them? Even if we are aware that we have those variables, do you really measure the presence of those confounding variables? And you can see the numbers here for the different components. And I just highlighted the ones that were, more like in a minority. So obviously, non-vesicular extracellular RNA is not systematically measured if you don't work with RNA, for example. And usually it's done after isolation of the vesicles. And I don't know, I'm not aware of a technique that can allow you to measure specifically extravesicular RNA besides using proteinase K and RNase to degrade the RNA prior to the analysis of the content. And also what is important is how do we measure them? So a lot of people have been reported that they use hematology analyzers to measure, for example, the content in blood cells and lipoproteins. Visual inspection also to measure the hemolysis is something that is widely used by the investigators. Flow cytometry is also a widely used technique to measure the concentration of platelets, red blood cells, and also the platelet-derived EVs. And finally, spectrophotometry was also a technology widely used to measure soluble proteins as well as hemolysis. So So what strategy we can use to minimize the confounding variables? And so something that was very interesting is a lot of people mentioned the use of guidelines for blood collection established by the working group of investigators from the ISEV, ISTH, and ISAC. So we see that there's 56% of the respondent on the task force use those guidelines, as well as close to 50% from the wide ISEV community. And I think this is something that is very positive. Obviously, we would like to see 100% if we really like endorse those guidelines, but this is just demonstrate the work that has been done since one of the first papers on standardizing the pre-analytical variables that have been published in 2013. And we can see that we have an evolution in terms to those publications in terms of the need of standardization, the using evidence-based guidelines to really establish what are the best practices to isolate extracellular vesicles, process the blood, isolate the vesicles, store the vesicles, so store the plasma in the serum. And in 2019, so Rink talked about it a bit earlier, we need quality control procedure and also transparent reporting. What kind of minimal consideration we need to have in terms of reporting the quality control of our samples? And so we have been working also, thanks to the participant of the survey, on a potential manuscript that will describe the reporting metrics, and I will discuss a bit more later. So different strategy has been used to minimize confounding variables: choice of anticoagulant, EDTA, citrate, the transport at room temperature, the time from collection and processing, and minimizing and record the freeze-thaw cycles. So these are the major strategy that people have been using to kind of minimize the presence of the confounding variables. But we saw, like on the previous talk, that we can name maybe 40 or 50 different variables that can affect the presence of those confounders. The other thing that is very important is some groups report the collection from fasted patients, and this is very interesting. I will talk a bit more from a clinical perspective, but obviously, if we collect the blood from fasted patient, we should minimize the composition in lipoprotein, and that has been established through evidence-based publication that you can see below. But having this kind of systematic collection can be burdensome and difficult in a clinical setting to really like create a biobank. I will discuss a bit more about this strategy. Also, we have two types of samples you can work with. Either you isolate, you basically collect the blood with your lab or collaborators, you process in a lab, and after you store it. Or you can also use archive biospecimens. This is, since the EVs are pretty stable, once stored at -80, it's very attractive to use like large biobank, institutional or even like international biobank. Now we're asking the questions, what kind of information we can get from those biobanks. So most of the investigator first tends to mention that they use both archive and fresh specimens, and few investigators only fresh or only frozen. And when I say frozen, so it's mostly from collaborators or biobanks. And who is responsible for the blood processing? So it was interesting to see that lab members are taking care of processing the samples, and also that the staff is trained according to the most recent guidelines. So this is kind of help us to build a bit of consistency on isolating, on processing the blood for AV research. And we have about like 20% of respondents who indicated that the clinical labs and the biobanks are in charge of processing the samples. And what information can you get? So we said that we want to get as many information as we can on how those samples have been processed, because we know that centrifugation, time from collections to processing are very important. So what kind of details can you get from those biobanks? So 60% in a task force and 75% from the ISEV community reported that they have the processing details, which is centrifugation speed. Have you used break to isolate the plasma or serum? What was the time between the collection and the processing? What temperature have you stored the samples, and freeze-thaw cycles? There's also a minority who described that lipoproteins, platelet, and RBC counts are provided. which I think is also something very important to keep in mind. And also about like 13% to 20% reported like no information at all, which raised a lot of concern about the utility of those samples if we cannot characterize their composition, especially on confounding variables. So in terms of how to report the quality of blood EV samples, so what confounding variables do you consider critical to report in blood EV studies? And obviously lipoproteins came as number one. Presence of erythrocytes components, platelet-derived EVs, and non-vesicular, also named like soluble proteins, are the major ones. And this has been pretty similar between the two surveys, between the task force and the ISEV communities. Now, how to report it? So we propose different options to report those the quality of the blood samples. The first one is the classic material and method section in papers, which is very investigator dependent. Some manuscripts, sometimes certain manuscript request very detailed experimental procedure to be described in a paper, but not all of them. The MISEV, so the MISEV is actually what you can find in MISEV 2018. It's not like a specific guidelines, but it tells you what kind of variables we would like to find in those manuscripts. There's also a couple of standardized checklists from the SPREC, which is a consortium for biobanking biorepositories that develop a sort of like standardized checklist that we can use to report the different steps from isolation, from blood collection to processing. It's a very extensive standardized like checklist. Like there's, I think, roughly like 80 or 90 different sections to fill up. So it's more biobank oriented, and I think that would be difficult to implement for our research at this point. The EV track platform also has been presented about like 25%. And also we propose to develop a new standardized like report checklist that contain basically the elements that have been established by the group. So this is basically a sort of like, we came with like 45 different items that we can basically have in a standardized checklist that could be attached for any manuscript that use blood EV studies. What we think is that those standardized checklists shouldn't be a critical point for reviewers to kind of reject the paper or accept the paper. I think it's just to inform the community about what kind of samples you have been using. And also we can allow some comparative analysis between studies if we see like similar approach. So we have the study informations that is pretty general. The pre-analytical variables that have been used for, such as was the patient or the donor fasted, what volume of blood did you collect, anticoagulant, and every parameters that we have discussed earlier. And also some pre-isolation quality control. So this is just to give a bit more like qualitative and quantitative measurement of the presence of lipoproteins, platelets, red blood cells, and they're also related EVs. And we want to basically kind of have more metrics to really assess like if two different investigators work on the same kind of like disease and have very different data, different outcome, can we use, for example, like those kind of standardized checklists to say, okay, the contaminants or the presence of confounding variables was different between the two groups, and maybe this can explain why we had discrepancy in the data. So I think this is something that we would like to see more used by the community. And after we also have, because a lot of people use the EVs after isolation, use the cyclone chromatography, immunopurification, intracentrifugation. So there are also some quality control post-isolation that needs to be provided to really assess the presence of lipoprotein, platelet, and hemolysis, and so on. So basically, what we know from those surveys is that the investigators, they acknowledge the presence of confounding factors, which is a good thing. We know blood is complex, and it seems that people are aware, even if you're an experienced investigators or new investigators, people are getting aware that we need to take into account those confounding factors, and they can impact the outcome. Most groups conduct the quality control, at least for lipoprotein, red blood cells, platelets, and platelet-derived EVs. There is no standardized techniques for the measuring to assess the quality control, but at least people report at some extent some element. Hello. Most investigators report the use of fresh specimens and guidelines from the ISEV, ISTH, ISAG working groups, and this, I think, it's a positive thing. And we really want to work on these foundations to really improve moving forward. The level of concern about the confounding variables is higher with the task force members. Obviously, they probably have more experience in working with blood-derived EVs, and we saw this morning, like, blood is complex, and for new investigators, maybe it's pessimistic, and it's like, oh my God, I'm not going to work with blood-derived EVs. But actually, you know, we see with those surveys that the ISEV members, they adopt the recommendation from the position papers. So we saw some position papers and guidelines that have been released, and it's kind of nice to see that at least a majority of investigators are really acknowledging those guidelines and try to use them in their studies. And so what is next for that part? So we want to move to a more reliable plasma and serum sample as starting material for EV research. So like I said, so we need to implement the latest guideline standards for biobanking of samples suitable for EV research. Also, one option that would be very interesting, and I know it has been discussed at one of the previous ISEF meeting, was kind of establish a web-based platform that can help investigators to generate personalized standard operating procedures. For example, you describe what method you want to use to study your EVs, what kind of sample, what kind of macromolecule you're interested in, and maybe we can generate, based on the evidence-based guideline, we can generate a sort of like minimal steps for your protocol and how to report those different elements. That's something that I think would be very valuable. And also provide a quality control report when you request archive plasma serum, and this QC report can also be submitted as an attachment with the manuscript. Something also that I find interesting is, you know, if you look at the different clinical societies, I mean, I was reading again yesterday about American Urology Association that I'm part of, and, you know, every time they have to establish new guidelines for surgical practice, every year they have an annual review that is published with new guidelines that are endorsed usually by the association. So in our case, we can think about those guidelines endorsed by the ISEV. We can have a team of experts that systematically review the scientific literature, because today we said that we're using like the guidelines from the ISEV, ISTH, ISAG that have been published in 2017. So it's already 5 years ago. And probably we have progress that have been made in the last 5 years. How do we keep consistently some improvement and updating of those guidelines? And I think that's something we should consider. Determine the evidence trend. So by looking at the benefits versus the burden, you know, there's probably some strategy that can minimize certain confounders, but if you request, you know, 4 days of processing, what's the benefits versus the burden? And after, provide some recommendation that could be strong, moderate, and conditional that investigators can use to really drive their research. So for the second part, I'm still on time, huh? Just make sure. Oh yeah, I'm gonna go faster. For the second part, so I'm just gonna give you an overview of how we're trying to build our biobank of specimens for urologic cancers. And again, I don't say that we have the truth, but we are trying to use what the community has been developing until now to really keep like some sort of consistency on blood collection, processing, storage, so we can do like some very meaningful studies, but also if any collaborators wants to get access to some samples, we know we can rely on those samples because we have, you know, follow kind of like the same protocol for all our samples. So basically there is three parts on the study. One is the study design, after you have the patient consent and you have the blood collection. And so usually what we do is like we submit a research protocol to institutional research committees and ethic board. Right now, what we do, we collect roughly 40 milliliter of blood, 30 milliliter with EDTA vacutainers, and 10 milliliter with SST tubes, so we can have some plasma and serum. And we also, something important, we always request information on if the donor take any supplements. Something that has been released 2 or 3 years ago for the FDA is that if donors take supplements in biotin, for example, vitamin B12, multivitamins, the biotins, if you have a high level of biotin in the blood, they can interfere with some of the biotin streptavidin-based assays. And this has been reported as an important information to be collected by the FDA. So that's something we always ask, and I will describe, I will show it in our emails. We don't collect specifically from fasted patients because we try to match the appointment of the patients in the clinic. And so if we were really taking only patients who were fasted, we will lose a lot of patients enrolled in the studies because we will be excluded all the patients coming in the afternoon or late afternoon to the lab if they have been fasted for 24 hours. We do a logistic meeting with the clinical research coordinator units and the biospecimen accessioning and processing lab in our institution. And this is just to demonstrate, to really establish a powerful biobank. You have hundreds of people being involved, and that costs a lot of money, obviously, but hundreds of people being involved at every specific step of the process. So after we screen the clinician's calendar and the appointment list, and we identify candidates based on inclusion criteria, we consent the patient. There is a date of appointment, and after we receive an automated email that looks like that, when we have it's systematic, it's automated, and we have the IRB number, the patient name, did the patient consume the multivitamins, and we have all the information necessary for the collection that comes directly from the biospecimen accessioning and processing lab. So this is always in an electronic inventory of our samples. And after the blood is drawn in a clinic lab, transported to the BAB for processing. And this is the thing that is very important. A lot of people have been reported that they process the blood in our own lab, which I think is great. And when I start working with the BAP lab, we process all the samples for the Mayo Clinic. We treat one of the largest volume of patients in the world. They were using, they use standard protocols that are not necessarily suited for EVs. And that has been a back and forth communication and showing the papers, that the position papers, to convince them that it's maybe not perfect, but 2 centrifugation is maybe better than just 1 centrifugation at 2500 G. And because of that, the BAP has been changing their methods for the entire enterprise. And this, I think, is something that is very valuable because it demonstrates that, we're trying always to move forward to provide the best quality of samples. And after what we have is that we receive those kind of automated emails to say that the samples are ready to pick up with transport on dry ice in one of our -80 freezer. And we also have this kind of document that report everything: collection time, start of processing of the blood, how much volume, how much vials. And after, we have another sheet with all the platelet, RBC, platelet-derived EVs that are provided to with the samples. Yeah, sorry, 2 minutes. So we established the Biobank in September 2019, and just before the COVID pandemic. But I just want to say, until now, we have collected plasma and serum from more than 400 patients. We have close to 9,000 samples, and they all have been processed the same way for that I described so far. We also have, what is very important is that all the specimens have clinical data that are extracted for electronic health records. We have about 50 variables per patient, and everything is electronically present in an inventory that is accessible with control access for any investigators who want to collaborate with us. And the last thing that I want to say is that, can we envision ISEV certified biobanks for EV research, a bit like we see with the ISO certifications? The thing, 3 questions that we need to think about is, how do we found those biobanks? Right now, the biobank that we use has been benefactor funded or institutionally. It doesn't come from grants. So how do we support the function of those biobanks? How do we access the sample? Should we leave access to those very precious samples to everyone, or maybe keep some samples for multi-institutional studies that are driven by the task force? For example, when we want to do some more characterization of the blood samples. And also, can we use those samples for biomarker discovery and validation studies? So that's the open questions that we can all think of over the next 2 days.
I just wanted you to have a chance. Have a chance to answer something. So if there are questions, so we have 4 minutes. So because it was a great talk
Thank
and
you.
great initiative, and I think this is moving forward. Sarah, who knows something about biobanks?
Yeah, I don't know if you know, but we have a very nice law here in Finland for biobanks in general, and we have a very, very good network of different biobanks together. And also we have the donor biobank. We started with the genomic studies and genetical background, but now we also collect plasma and serum samples. We tried to do it also for my sake, so that we could like somehow like standardize for the EV research. But to be honest, it's not optimal at the moment. I had to make a compromise because not everybody is EV fanatic persons like me. But what came, we are now running, PI is also involved, and University of Helsinki. I'm leading this consortium, 3 years consortium that is ending this year, where one of our aims actually were similar that it was here. And one of our aims is also to find the standard materials that could be then also be the internal, some kind of checking points. That because this is we skip that we try to do this because it's a huge task. And I would challenge that also a bit, because honestly, how you can be at the moment where we are now sure that what are the standards that you then say, because I think we should have some kind of inner quality measures that, because as you've described, there are a lot of different biobanks all over the institutions and organizations and so forth. It's not really easy.
Yeah.
And they are all collected sample material in hospitals. So why don't we try to find some kind of quality measures that would tell that who could get this kind of certificate, rather than we start to do like this prospective. We could also think about the retrospective material.
Yeah,
Sorry
I mean,
for the long, I know, Pia.
Yeah, no, that's a great point. I mean, when we started to collect samples, we didn't realize how difficult it was. And I mean, I would say we're lucky. We work in a medical institution that is a powerhouse. So I mean, let's say that we learn a lot also from them, and we try to adjust or give them some updates about you should consider EV research. I think it's important what you mentioned. There's two things that I think is important. One is, can we use what has been archived so far, right? And can we use some control metrics that we can use to not necessarily exclude the samples, but at least to report what we have been using? I mean, there's been samples that have been isolated, like thousands of samples that have been isolated. And I mean, we're not going to start from scratch. There's maybe a way to use those samples. What is important is like to report. If you have been using samples that contain platelets, yeah, there's residual platelets. That's bummer. We would like to have no platelets, but at least if we report that platelets were present and at that concentration, that's already give like a bit more information compared like to what we have right now. In the meantime, we can continue to collect to get some data. But I think it's a great point, and I think the work with the task force is going that route, right? And we need this information, because I don't know about you guys, but like getting sample from Biobank, I mean, sometimes they charge $100 per sample. So I mean, we want to get some good samples.